Breastfeeding hurts. Don't worry, your nipples will toughen up. Do not listen to this. For the past 5 years, I've worked with mothers to find a pain-free and enjoyable breastfeeding experience. Your pain should not be brushed over. I've seen firsthand the damage that pain brings to breastfeeding, and I'm not just talking about the physical pain, I'm talking about the effects of being in pain consistently. Right after birth, our hormones are fluctuating quite a bit, and it can cause an increase in nipple sensitivity. So pain, it's different from discomfort. Breastfeeding takes some adapting, but if you are in pain, that is a sign that something needs adjusting. Could be an improper latch, could be a tongue tie or a lip tie, could be an infection. There's a number of reasons, which I break down in this video. So click here if you want a deeper dive into the location of the pain, the timing of the pain, so that you can figure out what is the cause of the pain, what to do about it. Pain, especially chronic pain, it doesn't just stay in the body, it affects your mind too. And when you experience nipple pain during breastfeeding, your body releases cortisol. It's a stress hormone. And cortisol is great in short bursts, like when you're dealing with a temporary stressor, such as if your baby's crying, and we need to respond to our babies. But when it's constantly elevated, like from ongoing nipple pain, it starts to interfere with other systems in your body, including your ability to relax and bond with your baby. Cortisol, it works against the feel-good hormones that are essential for breastfeeding. So when you breastfeed, your body naturally releases oxytocin and prolactin. Oxytocin is often called the love hormone because it helps foster bonding between you and your baby and other people. It's what makes you feel calm, connected, and even euphoric during a feed. Prolactin, on the other hand, it helps with milk production, and it contributes to a sense of nurturing, which they're actually finding higher prolactin levels in fathers after birth, which is really cool. But here is the kicker. When cortisol levels are high, it can stop or lessen oxytocin release. This means that pain and the stress it causes has two big effects. One, can lessen the amount of milk you make, can interfere with your ability to bond with your baby during breastfeeding and at other times. It's like trying to experience the warmth of the sun on a really, really cloudy day. There's something blocking it. You might find yourself dreading feeding, feeling disconnected from this experience, or even feeling guilt, frustration, shame. It's understandable. When a mother has a lot of breastfeeding pain, it can speed up the postpartum depression and even psychosis problem that we are facing. It did for me. Breastfeeding is often thought of as a beautiful and bonding experience, but when it's painful, it can feel like the opposite. And I know this all too well, because when I was just learning to breastfeed, it hurt so bad. Everyone just kept telling me, it just hurts, it's normal, you'll get used to it, you just kind of have to get through it. And I remember coming out of the shower, and I could barely dry off because I didn't want anything touching me. It was just excruciating pain. And I'd pat myself down and do everything I could to avoid any extra pain. So when my tiny little premature baby would cry, I'd start crying. Not because I felt any empathy for him or because I wanted to hold him and comfort him. It's because I didn't want to touch him. I didn't want him around me because I knew it would mean more pain. And then the shame and the guilt blossomed. My baby was hungry and I didn't want to feed him. My baby was crying and I didn't want to hold him. The anticipation of the pain was so overwhelming that it overshadowed any of the joy I thought I was supposed to feel during these early days. A time that's supposed to be about connection and nurturing turned into a time filled with dread and shame and guilt. It wasn't right, and I knew it in my gut. And I know I'm talking right now to somebody who is going through this mental spiral, the pain, the dread, the guilt. It can feel so lonely, but trust me, you are not alone and you are not a bad mother. There's nothing wrong with you. You are in pain, and we need to get your pain validated and figure out what is going on so you can enjoy feeding your baby and you can bond with them the way that you want to. So the first step is figuring out why you have this pain. After that, we tackle the emotional and the mental strain. What are some practical things we can do to lessen the amount of cortisol in our body and stress in our body? One, deep breathing. I can't stress this enough. Exhale. Linger on the exhale. Take slow, deep breaths before you feed your baby, because you might have even just associated feeding with pain, and we have to kind of rework our system. So we take a big, deep breath in and an even longer exhale, longer than you expect. Do that a few times. You will notice your body relaxing. The next is oxytocin boosters, such as cuddling, calm music, and warmth, keeping your baby close even after they've been fed, just to be cuddling with them and touching them in some way. And the third is eye contact. There is something very powerful about eye contact, and we can just sit and stare at our babies, and that can help us with bonding. I mean, it's kind of why when you're struggling, right, internally, you're having like emotional struggles and somebody asks you how you're doing, you don't really look at them in the eye. You're like, yeah, I'm good. I'm fine. Thank you. You know, there's something about eye contact that just opens us up. But if you're looking for a step-by-step approach to pain-free latch, I have this video for you here. I hope this video has helped. I hope you understand the importance of getting to the root cause of the pain, and that by doing so, it's going to make things better, and it's going to help you bond even deeper with your baby. Love ya. See ya, pizza.